infection was reducing. But also, what was most important, some of the cancer linked to the liver. Of course, I mean, we spoke also of papillomavirus, as you know, in June of 2006 was registered by the FDA, Federal Administration. So is now very important because is the vaccine that is used to inhibit the 80% of the cervical carcinoma in the world. Second cause of death for women. And this is just the geographic distribution, and this, of course, it represents a very important step for biology, but also for oncology. Point of reference for many other findings in this field. Of course, I mean, when I mentioned before the cancer of the liver linked to the virus hepatitis B, we know also that some of the liver cancer are linked to another kind of virus, of another family, the C hepatitis virus. So when we talk about hepatoma, cancer of the liver, we must know that there are at least two viruses. Of course, there are many other causes like alcohol and aflatoxin and so on. But what is important that for the B virus there is a vaccine. For the C virus there are some drugs, as you know, not only the cocktail of interferon and ribavirin, but now, since at least this year, also some inhibitors of proteases. Of course, I mean, I want to go back to the studies of the 60s on bio-oncology. Since at that time I was working in Cincinnati with Dr. Habner Sabin, and there was also before me Meyer Koch from Germany. And they were studying some kind of early antigens that were produced by polyoma or SP40 in tissue culture. And when these cells were transformed, were able to give cancer to the transplanted hamster. Of course, I mean, if we were using the same virus for the adult animal, there was no development of anything. But if the same virus was used for the newborn animal, of course, there was the development of neoplasia. We know that in this case, maybe it was due to the lack of immune response. If this was the main thing, the same virus was given to the animal, and then an animal was transplanted, the transplanted cells. Well, in this case, there was no neoplasm, no whatsoever, but it seems that this was bound to a transplantation antigen, maybe on the surface of the cell. And that was very important because it might be very close to the early antigen induced by the virus in the transplanted cells. Of course, I mean, now we go back to the mechanism for tumor colonization and rejection from the antigen-presenting cell. Of course, I mean, this is presented to the helper cell, as you know, the director of the immunity orchestra, and by the mediators like cytokines was able to activate macrophage or most important toxic cells like CD8. And of course, this was to attack cancer cells. There was also humoral response by the big cells, especially the plasma cell, and in this case, humoral antibody were of course very important for another branch, another arm of immunity, as well said Fuderberg, one branch, one body, one arm for